Good morning.
Good morning.
The battle of eat or be eaten has waged throughout our world for eons. Bacteria, one-cell organisms, have battled us, the multicellular organisms, for a long time in this battle of eat or be eaten. This process is called disease. When the bacteria invade our bodies, that's called disease. It is largely inconspicuous and somewhat occult. This is a large problem. By current estimates, the Surgeon General has reported an occurrence rate of approximately 75%, and the ADA, approximately 80% of our population has some form of gum disease. And when you combine that with the fact that only half of the people actually go to a dentist to find it, the prevalence is high. And most of the times folks do not even know that it's there. And by the time they do realize it's there, it's done significant damage. In the past, there has only been one way to treat it, and that is surgical with a scalpel. The other part of this disease that's bad is that it contributes to tooth loss, and that is the major cause of tooth loss in adults over 50. So to treat it, we only had a couple of options. One option is no treatment, which of course leads to worsening disease and then tooth loss. You can treat it non-surgically with deep cleaning, but that results in a scar and only generally a small reduction in pocket depth. So surgical intervention is necessary. And it's usually performed by a specialist called a periodontist. And the way that works is like this. He takes the scalpel and fillets down to the bone and opens up the pocket where he can see in there and have access and vision to debride the root surface of the bacteria and their toxins. And then he usually places the patient on antibiotics. And then the bone has to be recontoured. We commonly call that grinding the bone down. And then laying the flap down lower with stitches. And of course, pain medicine, because they're probably going to be sore and sensitive to cold. This results in a longer tooth. Well, you might say, I don't want my teeth longer. Well, do you want your teeth longer, or do you want your teeth no longer? That's the only option that we had. Then with the advent of lasers, it has presented many new modalities for attacking these bacteria, because they can run, but they can't hide. Now here's how, if you look at your diagram, here's how laser therapy works. A very short, high-intensity pulse of laser light in the near-infrared area is delivered into the pocket with a fiber optic about the width of 2 human hairs. This pulse is so short and so intense, it is like a bullwhip that is like a neutron bomb that just causes the surface layer of the skin, called epithelium, to ablate or vaporize. Not only does this kill all the organisms right in that area by dissipating them, by removing them entirely, but it also penetrates deeper into the tissue and affects these pigmented organisms, much like disrupting an aquarium. And that kill is what differentiates this treatment from traditional treatment in large part, because the scalpel and antibiotics cannot do that. These bacteria have developed many mechanisms for hiding. They can hide in calculus and dental tubules. They lay dormant in sessile and planktonic forms. And antibiotics cannot touch that, but the laser can disrupt their biochemistry. Once this mass kill is done, it also unzips the layer between the skin and underlying connective tissue. This allows a clean surface to reattach to the root. Then a different pulse is used to activate the fiber in the blood to cause hemostasis, not cautery, hemostasis. This provides an environment where the bone can regrow and the gums can reattach. In 2003, there was a paper presented by Dr. Ray Yuckman from the University of Louisiana that proved that new attachment where calculus used to be on a root could attach to new cementum. Cementum is that layer that the periodontal ligament sticks to your tooth from. And when that's destroyed, it's usually permanent. But if you cleanse the root surface and provide a healing area, then a clean, sterile area, then it can reattach. That's also called guided bone regeneration, which has been around since the early 90s. So this provides a much better route for healing of the gums, and there's less pain involved. It's a little bit slower than traditional, but a better way to heal. And so it's not necessarily right away that we need things done. It's the right way we need things done.